My name is Professor Farooq Khan. I'm a consultant psychiatrist. I work mainly for the older adult, that is over 60 and 65 years of age people, but I also see the adult patients as well. I'm also the clinical lead for dementia in the Midlands region, and that means I've got the responsibility of clinically overseeing the care of dementia across the Midlands region. And I am also the visiting professor at University of Chester. The reason I decided to become a doctor was mainly that I feel helping out people, especially when they are suffering from difficult problems, the ailments they go through. I grew up in India, and I've seen a lot of suffering that happens in people, and there are treatments available, but people can't afford. So one of the reasons why I chose medicine as my specialty was to help people who are not able to afford and to provide them with that assistance that are needed. People in the poor health situation become quite vulnerable, and I think this is a noble profession, an honorable profession that can help and assist people come out of their difficult situation. This was one of the main reasons I chose medicine as my career. Psychiatry as a specialty, the reason why I chose that was mainly because it is very close to my personal attributes. So people have found me to be a good listener. And one of the reasons why people approach the mental health professionals and psychiatrists is to talk about the difficulties they're going through, and they would like to get some solutions out of it. So I found some of those qualities in me as listening. People have also found me to be quite patient about resolving the problems. And this is another skill a psychiatrist needs to have, to listen and to be patient to come to a conclusion of the diagnosis and provide the assessment. Mental health morbidity is also quite significant in the populations. And to find the time to provide that input and support to people, to listen to people, to hear their problems is something that is required in a psychiatrist. And I found those to be in me. I've also chosen this specialty of psychiatry as my career, is because it's a comprehensive field. It's a holistic approach, a specialty in which there is a biopsychosocial model that is used. That means biological model in which medications are at play. But we know that in mental health, medications only are not the solutions. There is also psychological input, that is talking therapies, speaking to people, and also the social side of things that are important. So psychiatry provides a comprehensive biopsychosocial model. And because of the holistic nature of this, I chose this as my specialty. I think the patients, like most things about me, are things like my approach. So my approach towards them is quite patient and listening. I give the time that is required to be with the patient and to listen to the problems. I do have in-depth understanding and knowledge of my subject, the treatments I provide, the diagnosis I provide, the assessments I do. I've got quite a comprehensive knowledge about those treatments, the ailments, and the treatments and management. And people have found me, the patients have found me to be quite confident in my treatment. I also found that working with the older adults and providing that type of support and input to them, it needs a respect and dignity approach, which sometimes is missing. Patients have valued that I do provide that respectful, mutual respectful conversations and treatment. And then I found the same with the working with the older adult. Even working with the adults of working age, I found them to be very respectful, and I like that type of approach of mutual respect and dignity provided to each other. The mental health cause lots of difficulties and problems in individuals' lives. And being able to understand that from a point of view of a professional, where you are in a position to provide and guide and support that person, that patient, that is something I found to be quite valuable while working with the older adult populations. While working in the mental health, it is not uncommon to see frustration, stressful situations, and difficult situations and conflicts arising all the time. One of the ways I cope and deal with that is to stay calm in most of the situations, and that comes with the inner peace that I can achieve by practicing some of the practices in my day-to-day life. Understanding of others' perspective is one of the important skills, I think. Being able to understand and stand in other people's shoes is quite pivotal in achieving your inner peace. So I think in those stressful situations and circumstances, instead of jumping to conclusions and acting in haste, it'll be always useful to stand in other people's shoes to see what and how they are going through and they are managing the situation, and that will bring you that peace and calm. I also try and avoid the conflict situations with people, and if that arises and comes, I try to quickly resolve them by speaking to them, by discussing the problems with them, and also just analyzing the situation, taking a step back from that difficult conflictual situation, and then come to a resolution by speaking to them immediately.